This is week 2, video 2 on chapter 4, policy analysis and design. The stages of the policy process, this is just a model of the whole policy process. And what we are going to talk about is policy analysis and development, which are the arrows are pointing to those areas of the policy process diagram. The federal government's involvement in social issues. In the 19th century and before that, there really was not very much governmental involvement in social issues. There was a rapid expansion in the 20th and 21st century. Medicare and Medicaid were created in the 1960s. Actually, it's not on here, but Franklin Delano Roosevelt, after the Great Depression, which was a huge disrupting event, was able to pass Social Security because many people did not have any retirement pension. So Social Security was going to be a way that they gave money to the government from their paychecks so that they would get Social Security or a pension from the government from that money when they retired. In the 60s, Johnson was able to create Medicare and Medicaid around 1965, and there was a big disruption then. The President Kennedy was assassinated, and he was able to President Johnson, was able, after that assassination, President Kennedy wanted civil rights amendments to be added so that people of color and others were we were all treated equally. He was not able to get that, but Johnson was able to, after the disruption of Kennedy's assassination, was able to move forward with civil rights acts, and was also able to create Medicare and Medicaid. And Medicare and Medicaid actually helped because with the civil rights issues, because he was able to say there would not be Medicare and Medicaid funding going, or at least Medicare. I don't think he could affect Medicaid, but funding wouldn't go to people who didn't treat all people equally. So there was not going to be desegregated hospitals any longer. Then the passage of the Patient Protection and Affordable Care Act, the ACA, in 2010. That was a new level of trying to get people who did not qualify for Medicare and Medicaid affordable protection and protect people with pre-existing conditions. That happened after a recession, and President Obama was working to fix the economy and was able to incorporate the changes of the Affordable Care Act at that time. Current considerations, a quadruple aim initiative. That's when you want to, what they want us to focus on is, number 1, enhancing patient experience. Number 2, improve population health. Number 3, reduce costs. And number 4, improve the work life of healthcare workers. So when they're looking at involvement now in policies related to healthcare, those are the quadruple aims that they want healthcare policy to address. Availability of funding. Is there money for basic and clinical research? Is there money for healthcare worker education? Is there money for as I said, clinical research. And when I'm thinking of healthcare education, they actually have funded monies because some areas don't have healthcare workers, especially physicians and somewhat nurses, that if you go to work somewhere there is a deficit of providers of your nature, then you can get your student loans forgiven. I know because there's a shortage of nurse educators, there's policies that they reapprove grant money to provide people who get their master's or doctorate degree and teach in a public nursing education program. They will get their loans forgiven, so they don't have to pay loans back. It's important because sometimes private institutions can pay more than public institutions, so this is an advantage. And then a consideration is how to incorporate policy design into all phases of the policy process, so that you're not thinking about what the design is when you're working on how you're going to implement. You need to think about the policy design throughout the process to have the greatest success. The policy process is the next topic. Policies that address social problems are usually formulated by many groups, and that proliferation of participants in policy formation make it difficult to achieve systemic program design. When you have multiple groups competing for attention to get on agendas about solutions to problems, rather than working to the same problems, rather than working together, they're almost working against each other. There needs to be a coming together. People need to start working together rather than new groups popping up to try to address the same policy, because it gives them too many ideas to work with, and splits the attention, so that each problem is in policy are not being addressed as effectively because of that. Unfortunately, because of time constraints, decision making is often conducted hastily, so there'll be a lack of information. It may be that constituents are impatient to get a policy passed, and there may be lack of expertise by the policymaker or by the groups trying to push the policies. That's why we need better research. We need to work together, we need better research, and we need to have a coherent and unified voice when it comes to trying to get healthcare policies enacted. Much of the policy that regulates nursing practice is determined at the state level. We'll talk about that more in depth later in the semester, but as you know, it's the Board of Nursing in the state that it's the regulator that basically they're enforcing the state policies regarding nursing practice, the Nurse Practice Act. This is what guides our practice, and if we want to make change in nursing practice in the state, then we have to go to the Board of Nursing and get their involvement. Unfortunately, what people will try to do is do a backdoor, and I find this with healthcare organizations that are like hospital organizations or long-term care organizations, they try to get the legislators involved. You need to do that, but you also need to be considerate of the board because you are a nurse and you don't want to be seen as trying to work against the board of nursing. You want to be seen as working with the board of nursing. Research informing the policy process. Health services research. It looks at lots of factors, systems, and processes that are involved in the delivery of healthcare and informs policy in a number of ways. The big thing, research is really important. Research helps us to identify the problem. It helps to weigh the risk and benefits of possible solution. It helps us to estimate the cost and benefits of each solution, which will help us to make the best decision and help as we decide which solutions to back as we try to get legislators to move them to the agenda and become policies. Healthcare research is multidisciplinary. Some things that have been researched are increasing access to healthcare, patient safety, improving nursing care, improving patient outcomes, providing, as I said, info about cost benefits. And you want to try to, one thing about research that'll help people like us, we want to get involved, the research arms of the government that do healthcare research develop data sets. And the data sets, we find data sets related to our issues and our problem or solution, and we can use that to help inform our efforts to be involved in the policy process. Public opinion informs the policy process. I talked about this. It was in the last chapter. It's unfortunate that the research, the models have said that there are 4 groups of society. The advantaged are the politically influential, and the public views them positively. Dependent, they're politically weak, but the public views them positively. Contenders, they're politically strong, but perceived negatively. And deviants, politically weak and perceived negatively. We have to be careful that policies don't always favor the advantaged and punish the deviants. I hate that they use the term deviants, but people that may be perceived negatively by our society still impact our society. They are still deserving of basic human decency and healthcare and rights. So we need to make sure that as this is formulated, that we still push forward policies, even if public opinion may be negative, or find a way to spin those policies. For example, when you think about, I'm not calling these people deviants, it's what the author of the book calls them, deviants. When you think about drug addicts, when you think about the problems we are currently having in this country and in our state with addiction, even though those folks are viewed in a negative way, we really need to ensure that we are pushing forward policies that will not disadvantage them, but will help them to achieve better health care, because we know that the addiction crisis is costing our country a lot. It's costing our state a lot. And if we can't get people to view it from a positive, a positive outcome because we are just helping people improve their lives, we need to spin it and say, for those who won't see this as just human decency to assist these folks, then we talk about the cost to society of addiction and how policies that help people that are addicted help improve the economy. The design issue. Sometimes when we create policies, they create what we mandates, and unclear mandates sometimes we result, when you think about what the intent of the legislation was, and bureaucratic behavior, because bureaucratic behavior wants to make a bunch of rules and doesn't always think about what's going to happen when those rules come in place. And these are things, when you think about unfunded mandates, and unfunded mandates are going to cost the hospital, because the government is saying we now have a law or policy that you have to do X, Y, and Z. And the hospital has to figure how to do X, Y, and Z by whatever date the government says. But the government isn't giving them any money to do X, Y, and Z, so it's unfunded, and it can be costly and have unintended consequences, and cause the policy to fail. This isn't a healthcare example, but it's a state example, an education example. In 2010, I think it was, the governor of Ohio said that all colleges had to go from quarters or terms to semester, all public colleges in the state of Ohio, by fall of 2012. Now, that was a lot of work for those of us that were in terms or quarters. And it was a lot of work. Every course had to be redone. All of our systems had to be rebuilt for looking at things in regards to semesters instead of terms. It was very costly because we had to pay people to change all the systems, all the courses, all of our information everything had to be changed and updated, and it was a lot of work. And we did it, and we didn't have a choice because we wanted to continue operating as a college, but we were not given any money to make that happen. We had to do it without any funds, and we were fine, but some schools, it impacted their ability to operate because they were so costly. We weren't allowed to fail. If we failed, we wouldn't be a college anymore. So a failure was unaccepted. By shifting the focus of study to policy design, a more reliable answer regarding policy success can be found. You have to understand, when you think about policy design, you have to understand policy tools or instruments chosen for policy design, and it requires the understanding of underlying assumptions of policymakers during the design process. It gives us more time to think related to making these decisions. Policy instruments are government tools. Basically, Schneider and Ingram did a study analyzing government tools or instruments and underlying behavioral assumptions as variables to guiding policy decision and choices. They argue that this tools approach moves policy beyond considering just a standard analysis in improved frameworks. To understand which tools are the most productive, emphasis should be on using them in conjunction with a particular policy design. The first type of tool is authority tools. These are most frequently used by governments to guide people and officials at the lower levels. They're statements backed by legitimate power of the government that grant permission and prohibit or require action under designated circumstances. This would be a law or a regulation. That's an authority tool. If there's a law or a regulation, you have to, it'll either say that you can do something or you can't do something under designated circumstances, and you have to obey it or there's repercussions. So it's an authority. The government has an authority figure. Incentive tools, these assume individuals will not be motivated to take action without either being encouraged or coercion, being threatened, basically. They rely on tangible payoffs, whether those are positive or negative, that there's something that's going to happen to motivate you to an action. This tool assumes individuals have the opportunity to make choices, recognize the opportunity, and have adequate information and decision-making skills to choose the best option. This isn't always so. Not everyone, not every person, not every legislator has adequate information or has the decision-making skills to always choose the best option. Capacity building tools. These provide information, training, education, resources to enable individuals, groups, or agencies to make decisions to carry out activities. These assume populations will be motivated without incentives. And these require the populations be aware of risk factors associated with the tools and how the tools can help. But we know that not everyone will do what is needed in one situation or another. I mean, just because you know something is the best or the right thing to do doesn't mean that you're going to do it. So the goal here is to provide that capacity, provide the information, but that doesn't mean that people are going to receive it and be able to act on it. Symbolic or hortatory skills. These assume people are motivated from within and decide whether to take policy-related action based on their beliefs and values. Some example are some lower, using the lower number legislative bills reserved by congressional leadership. The lower number bills have higher esteem attached to them. Another example is federal requests for proposals to research a particular topic. When in healthcare, when they see a problem, a lot of times what the government will do is they will what the legislator will do, Congress, they will set aside money for research, and then they will send out, a call where to healthcare professionals. They will publish it and say, hey, we want to research this, submit a grant application, here are the criteria. We go on and they have a Zoom meeting where they tell us all about what the parameters are, and we write a proposal to research something, whether it be pure research or whether it be we're going to set forth an idea that we have, and we're going to research to see if it's really going to work. And if it works, after, we have to give you all the data about it, and if it works, it can be used on a larger scale. If it doesn't work, when people come to them saying something similar, legislators will say, nah, that's not going to work. And then symbolic tools are like the presidential executive order. that presidents can, they can create an order, but they also can, when a new president comes along, they can rescind the orders of prior presidents. So it's something that can be done, uh, uh, rather than going through the whole legislative process. And some things the president can write an executive order which will uh, allow whatever solution he he or she, it's he all the time though, but whatever they want to put forth, they can do that through an executive order rather than trying to get a law enacted on a limited basis. Learning tools. These are used when the basis upon which target population might be moved to take problem-solving action is unknown or uncertain. It's often used with policies that are open-ended in purpose and have broad goals and objectives and may require needs assessment to be completed. This is where they do it. Needs assessment, they see a needs assessment seeing what people actually need or want to learn or need to learn, what people need or want to the government to do. They want to find out what is important to the constituency, what is important, whether it be to all of the population, whether it be the population of nurses, the population of physicians, whoever. They want to learn more. Learning tools help to design the policy in the end. The behavioral dimensions, nurses and APRNs, you have to understand behavioral assumptions and the political context in which they exist. Need to know the political climate in which social problems are addressed. That will often prescribe the choice of tools to be implemented. You need to know which tools are best in which group of clients. Those are behavioral assumptions. There's a case study on COVID-19 disparities in the CARE Act in the book. Basically, they noted disparities in COVID cases and deaths. These disparities were based on income, education, and structural racism. They created the CARE Acts, which were money that were given out to groups. These groups included small businesses. There were credit provisions, student loan relief, and money given to like state and local governments. $2 trillion was earmarked, set aside for CARES Act. And I know that hospitals receive CARE Act monies, healthcare education programs like at Cincinnati State received money. We needed to try to get more healthcare providers, and especially during the epidemic, we needed more equipment because people needed to be spread out and not being on top of each other, sharing equipment. So we were able to write grants, to get money, to get more equipment and to money to reimburse students when they got COVID for several weeks and were really ill, and we could pay off that portion of their student loan. They got money so that they weren't on the hook for the semester that they couldn't complete because of getting COVID. And we even received money we had one nursing lab, the LPNs and RNs shared. We received CARE Act fund from the county to create another nursing lab. So there are 2 skills lab for the pre-licensure nursing programs. So remember that as nurses, we need to participate in the policy process. We need to understand how the process works and where are the points where the greatest impact can be made. We need to learn to work together and not separate. And we need to leverage our numbers and our influence as a respected profession to participate and get the solutions to the problems that we want to elevate addressed and enacted by policies and legalities at times.